It would be great news for the prospect of containing the coronavirus pandemic if only people with symptoms typically spread the virus, as the World Health Organization said yesterday. But the WHO's announcement was immediately met with skepticism and pushback from prominent health and medical experts, underscoring how the scientific community is still far from consensus over how the novel coronavirus operates. The question of whether asymptomatic people were helping drive the virus's spread is critical, and a central argument for social distancing and lockdowns. Because most researchers believe this is a common way the virus circulates, even people at low risk for the disease or who were not showing symptoms were nonetheless warned to behave as though they were already infected. Children and teenagers rarely seriously stricken by COVID-19 were taken out of school for the remainder of the academic year, and all people were advised to wear a mask in public places, for fear they could unknowingly transmit the illness to the elderly and others highly vulnerable to it. But now the WHO says asymptomatic people are not a main driver of new infections. Maria van Kerkhove, head of the WHO's Emerging Disease and Zoonosis Unit, didn't entirely dismiss the idea that people without symptoms can spread the virus. But she did say contact tracing research from around the world suggests that it's much rarer than previously thought. We have a number of reports from countries who are doing very detailed contact tracing, Kerkhove said. They're following asymptomatic cases. They're following contacts. And they're not finding secondary transmission onward. It's very rare.